where do I go from here and kind of what are next steps. There's tons of information out there on social media and from different providers, and it can be a lot of times different information or kind of information where you might not feel what is right specifically for your child. A little bit of backstory about myself is I have been working in the ABA field for right at maybe 7 years now. I started off as what's called an RBT, which is working one-on-one with clients, and then I have worked my way up to schooling to be a BCBA, which is the supervisors of these RBTs, and then I am now the regional coordinator for my company. So we'll kind of go ahead and get started and kind of just talk about some of the benefits of ABA therapy, what it is, kind of what it looks like, and things like that. So kind of overview of today, like I was just mentioning, is what is ABA therapy. In our field, we kind of have the running joke that we're the field of acronyms. So you might kind of be confused or not really knowing like what these acronyms mean, and kind of part of my job here today is kind of help explain what those are, how to get started with services, what are the different types of settings for services, so that's a big thing as well, how this actually works in real life, and how some practical tips that you can use within your home, just taking from this slide and presentation today, and then a couple of just different resources and support for your families as well. And if I am talking too fast, or if you need clarification on anything, please let me know. We'll also have a slide towards the very end as well where y'all can kind of ask questions and things like that too. So this first acronym we're going to look at is Applied Behavior Analysis, and this is what is known as ABA therapy. So this is a science where we are used to increase skill deficits and decrease behavior excesses that are impeding to communication, social opportunities, and daily living. ABA therapy can, but is not limited to, decreasing these maladaptive or challenging behaviors, which can be hitting, elopement, running away, fighting, those types of things, increasing social and communication skills, increasing self-regulation and emotional intelligence, increasing problem solving and executive functioning, and as well as increasing vocational and life skills. The science has been around for a very long time, but I feel like it's kind of gained more, I would say, like social media presence here lately, but our field has been along for a very, very long time. So that is kind of like the field in itself. Within the field and kind of getting started with this therapy, I kind of wanted to touch on is like what is needed to get started for services. So if you have received a diagnosis from a psychologist or developmental pediatrician or neurologist, and they've given you this diagnosis of autism spectrum disorder, then this is kind of the first step of what we call this comprehensive diagnostic evaluation. Another acronym here is a CDE, is kind of what we refer to it a lot of times. Sometimes these do need to be within 5 years for certain insurances, which is very frustrating because I'm sure it's just like y'all know that there can be years long for a wait list to get diagnostic testing done. So that's a big barrier and something that is really frustrating on our side of things because we want to get services going, but unfortunately this is just some required documentation that is needed to get those services started. We will talk a little bit later at the end. I do have a resource actually for a website that is what we call like quicker diagnosing, as I know that's a big barrier for families, is kind of getting that official diagnosis. So some insurances may also require a referral or what's called like a prescription of ABA therapy. This does need to come from a physician, a psychiatrist, or either a licensed practitioner, and this is also called a letter of medical necessity as well. This letter will typically read by saying, like, I, the physician, say it is medically necessary for your child to receive these ABA therapy services. And then kind of the very next step after that is just verifying insurances and eligibility of coverage of ABA services. This can look like primary insurance as well as having secondary insurances, maybe as Medicaid or CMO of Medicaid. So that's kind of a lot of our back-end process as well too, is really advocating and fighting with these insurance companies to really give these medically necessary services for your child. So now we kind of talked a little bit about the field of ABA and kind of like what ABA needs to get started, but there is different settings of ABA. So there is what is called a clinic setting of ABA, where it is a literal small building or a building that is all ABA clients is what we call call them. And so sometimes in these settings, it can be dissimilar from homes, making generalization and maintenance less likely. So if your child's been attending a clinic for full services day, and then they're being picked up in the day, those skills can kind of make it hard to what they've worked on in this building and might not transfer to the home setting. Children are segregated a lot of times from their other peers, as well as siblings and families as well too. And so that's one thing that we kind of really love about our home and community settings as well as school settings, is they're surrounded by other peers as well. Behavior goals are often less individualized, not necessarily aligned with family needs. So a lot of times what we call is like cookie cutter goals, and so there might be some times where we're really just trying to get goals going, and we're not as much individualized. And there's often limited or no parent training typically provided. I myself has worked in both clinic setting and home settings with ABA companies, and there's definitely a big disconnect sometimes between family services and then our practitioner and teams. And that's one thing that I do highly love about our home and community settings with this type of services, is that our interventions are delivered in the environment in which skills and behavior change are needed and within natural routines. I have some families that come to us and they're like, I have never been to the grocery store with my child because I'm nervous and we've never done that. So we will literally have our team go to the grocery store with them to be able to work on that in like that real life time setting, and you're just unfortunately not going to get that from that clinic setting. More individualized approach, as well, kind of mentioned earlier, is that our goals are really individualized. So if it's a grocery store we're having a hard time with, or safety in the park, not running away, those things like that, it's definitely more individualized for those different settings. And then our functional skills are established more readily and generally maintained. So when we're in the home setting and in these community settings, we are working on our therapy goals with you as a parent right there involved. So the really cool thing is that the RBT might be working with the child one-on-one, but mom is also sitting right here watching. And so it's a beautiful thing where mom's like, oh, okay, cool. And then you can do that after session when the RBT or the BCBA is not there. Families become more empowered to support their children and reducing the need for professional assistance. I'll kind of hit on this in a little bit, but a kind of running saying within our field is our whole point of our job is to work ourselves out of our job. Y'all are y'all's kids' biggest teachers, and so really our point is to kind of really start and kind of get services going, but then work our way out of services as well to really be able to transfer those skills. So common goals of ABA therapy and application in the real world. ABA therapy is absolutely used everywhere, as behavior is everywhere, kind of like how we mentioned earlier. So this can look like at home, us working on daily living routines and communication, teaching communication during mealtime, asking for more food, more drink. Some of my favorite daily living routines is really working on hand washing, or I have one client right now we're really working on putting away his laundry from the laundry basket into his closet and things like that. So those daily living skills are really important for quality of life. At school, we're following directions, building play, social skills with peers. In the community, social and safety skills, so knowing their address, being able to call mom and dad's phone number if there was a safety concern. These are kind of all skills that we work on within ABA therapy. And like I mentioned earlier, our whole point of our job as a professional is to work ourselves out of our job. So this is why our parent involvement is so heavily kind of required, but also wanted in ABA therapy, is because we're working as a team together to help teach these skills. So kind of beginning services and what this kind of looks like. So our first acronym here that we'll see is what's called a BCBA, and this is a board certified behavior analyst. And what they are going to do is they are going to start conducting what's called a behavior assessment. And during this assessment, the provider will be doing a lot of these things on the back end that might not look like they're doing all of these things. Sometimes our providers come in and it's a conversation with mom and dad, and we're kind of getting all of this back end information. But these are, like I said, a couple more acronyms that we're going to look at here. Our FBA is a functional behavioral assessment, which you will hear so within the school system as well. A behavior intervention plan, which is a behavior plan helping to replace and decrease some challenging behaviors that might be persisting. Preference assessments, environmental checklists, direct observations, curricular assessments, and then creating these individualized goals to increase these skills that we want to see. Defining target behaviors that we are targeting to replace with those functional skills, and then parent and caregiver proficiency. I feel like sometimes people hear ABA and they view it as we are only wanting to stop behaviors, or we are only wanting to take away traits of children with autism, and that is just flat out not true. A lot of times what we are looking at doing is if we have a child who is engaging in aggression, so they are hitting mom and dad because we come in and we say it's because they want to communicate they need something to eat. But right now, the current skill that we have to communicate that is through hitting. What we're gonna do is work on decreasing hitting, but increasing our communication to be able to say to mom and dad, I want food, I want drink, those things like that. It is never our goal or anything like that to take away any type of characteristics or traits with autism. That is just simply fake news. A lot of those times, those are some of the things with our kiddos that we love the most. And then we kind of, like I said, are working with the families to kind of figure out if some of the traits or symptoms of autism, if they are impeding day-to-day life, then that might be something that we look at, maybe more so replacing. But if it's not harmful to your child and it's not something that you as a family would like to decrease or replace, we're never gonna do that. This plan is then sent to insurance for approval, which can be really frustrating sometimes because insurance companies like to tell us what our children do or don't need, and those phone calls are really fun when we're advocating and telling them that they do in fact need these services. But that's a lot of the things on the back end that I myself do and my team does, so the family doesn't have to worry about anything of that nature. So we've kind of done our assessment and we're getting going with what's called like ongoing services. So after our behavior intervention plan and supporting documents are approved by your funding source, you are assigned what's called a registered behavior technician and then a board certified behavior analyst. These are commonly referred to as RBTs or BCBAs. Your RBT is going to work one-on-one with your child, and then your BCBA is the supervisor working with that RBT to making sure that the plan they wrote from the assessment is being implemented correctly by the RBT, and as well as working one-on-one with the parent. A kind of quick scenario that I like to throw in there with this is kind of your RBT is a nurse, and the BCBA is kind of like the doctor in a sense. Your treatment and interventions are monitored on a monthly basis to evaluate progress made on instructional goals and then caregiver goals as well in the plan. And then our authorizations typically last 6 months to 1 year, typically more the 6 month side. And the client and family will be reassessed at the end of each authorization to determine recommendations for ongoing services to continue based on a review of the data, driven progress, and medical necessity for services. So while your ABA services are going, your RBT is working with your child, they are taking data constantly. It is kind of the whole driving force of our field is we have these goals that we said we want to work on, but is the data showing progress? Is the data showing success? And if not, we're going to reword those, we're going to change those and do some different things. Collaborating with your ABA team is so important. We are, like I said, we're here as a team all together. It just simply would not be effective, kind of like I was mentioning earlier with that community setting. If our team is solely doing these things and the parent's not involved, it's really not gonna be able to generalize for when we're not there, and that's our whole goal, like we've mentioned. So communicating with your BCBA and your RBT is super imperative to kind of make sure that you're aware of what goals we're working on, what interventions we're using, and kind of like what is going on in your child's therapy. Share what's working and what isn't working. There are so many times I have written goals or I have came up with this like grand plan of an idea that we're gonna do to work on hand washing or eating food, and I thought it would be perfect, and it is not at all, and that is okay. So definitely advocate of, like I said, what is working and what is not working. Practicing these skills together at home when your sessions are not being held is so important as well. If you were to do your job within your day-to-day, but you only did it 5 minutes a day and the rest of your time, it wouldn't coincide. So you really want to make sure that we're kind of, like I said, practicing and doing these skills even when your team is not there in that home setting. Reviewing the treatment plan of care and bit before beginning services. I've heard some horror stories, unfortunately, within other companies and other settings. If you as a parent have no idea what your child is working on or what your child's goals are, that is a no-no, and that should not be happening. Your BCBA should always kind of be reviewing these goals and this treatment plan of care with you so that you are fully on board of what is going on within services. Our research shows that when parents work with our ABA team, not just send their child in, it can significantly boost confidence, reduce stress, and also help children use these skills in the day-to-day life, which is our overall goal. So I was putting all this information in this PowerPoint, and I could literally talk about this topic for hours, and so there are so many interventions and tips and things that we can kind of like take away, but I wanted to kind of just put just a couple in this PowerPoint today to kind of take home as like quick tips, but a lot of times these are things that your BCBA and your RBT working with your child is really going to be working with you intensively within that 6-month authorization period. Some of the quick interventions that we like to use that are really successful is visual schedules, especially for those challenging routines. Within the home setting, some of my favorite times to think about is on a fridge. If you have like a magnetic fridge, putting different visual schedules on your fridge for getting ready to go to school. Visuals have been known to be highly effective with children on the autism spectrum, and it is even for ourselves. If I have a visual schedule, it really helps us. It's kind of like a to-do list. Are these first then instructions, visuals for transitions, as well as eating. So an example is you have your child who absolutely just wants to play on their device, play on their iPad, but like we have to eat dinner. Kind of give this first in of like first we eat dinner and then we get the iPad. This can be used within a visual, obviously a verbal instruction, but this kind of like first then instruction is very, what is the word I'm looking for? Success a lot of times when we are using those kind of things. Positive reinforcement, so all of us receive positive reinforcement throughout our day-to-day lives as well too. The whole reason why we go to work and do our job is because we get a paycheck. And so that kind of positive reinforcement is the same thing, and kind of the principles of ABA therapy is that we are reinforcing the behaviors that we want to see. So if your child is having a hard time of getting in the car seat or getting in the car and staying buckled, we would kind of work on that and provide that positive reinforcement for that behavior that we want to see, which is then going to increase that skill. Other structured choices to promote cooperation. So I hear this a lot of times from families is like our routines that are just absolutely we have to do. We have to get up, we have to go to school, we have to eat dinner. But a lot of times for a lot of our children and even us as adults, like we want autonomy over those things and we want to feel like we're in control. A big way to kind of help with this autonomy and control is give it like it is a choice in their mind. So hey, like we have to do this, but do you want to do it in 2 minutes or 5 minutes? So they kind of get that choice to kind of see like, okay, I'm choosing, but in reality, they're gonna follow through with whatever is absolutely necessary at that time. So modeling and prompting your daily living skills. I've mentioned visuals already, but these also really help support beneficial and are beneficial for lots of learners. If we are working on getting dressed, a lot of times we've used like visual pictures of a kiddo. I've even used a picture of them. So I'll take a picture of them, we put it on a piece of paper, and we practice like what getting dressed looks like. And then this, once, like I said, generalizes to helping them be able to do the skill independently. Because that's, like I said, going back to that's kind of the whole point of our job is to kind of help them learn these skills and then fade back completely. So it is independent. We want to make sure that we're giving some do statements versus don't. How many of us have said, don't hit your sister, and then the next thing they do is hit their sister? Those don't statements, a lot of times, and it is so hard to do, y'all. Like, it is so natural. I catch myself doing it all the time, and I'm, ooh, tell them what you want to see them doing versus not what you don't want them to do, because all it's going to do is increase this behavior that you're not wanting them to do. If communication isn't happening verbally, we want to find ways to foster that communication. This can be with visuals, sign language, and language devices. This can get confusing sometimes because there is like speech therapy, and within our field we do have this speech side of us, but we always are going to recommend and make sure that we are remaining within our scope of practice. Our biggest thing for speech is that we want to promote communication if it is causing behaviors. So like I was mentioning earlier, is if we do not have a mode of way to communicate our wants and needs, and that is why we're having behaviors, then we're going to teach communication to help replace those so we're not engaging in those behaviors. But absolutely please, if speech therapy is recommended by your doctor, ensure that they are receiving those speech therapy services because that is not fully within our scope as well. Just a couple quick success stories. Like I said, I was having a hard time of putting all this information in kind of one little snippet, but just kind of some key takeaways is that behavior change does take time. Consistency is key. I have worked with families, many families over the time, and kind of one thing that I always like to start off with is we're working on this, but it's not going to change tomorrow, just like our behavior too. If you've never woken up at 5 a.m. in the morning, you're not just all of a sudden going to start doing it tomorrow without any type of behavior change there. So it does take time, but consistency is key. Our small steps do lead to big progress. So once again, toilet sitting, if we're tolerating sitting by a sibling, but then we tolerate sharing a toy with a sibling, so then we're going to play together appropriately, or just a quick example. So some small success stories of just, I have some parents like, oh, they will never do that. They just can't do this right now. We take those small steps, and then those are really gonna be those big progress that we see and kind of meeting those big goals of what we would like to be doing within 6 months to a year. A child learns to use words and communicate with his family members by pointing, grabbing his wants and needs versus hitting. So I kind of hit on this a good bit today, but communication a lot of times is one of the biggest barriers for the children on the autism spectrum. Their needs are just not being communicated, unfortunately, in a way that is easy for us as adults or other adults to kind of understand. And so it's a lot of times our biggest priority is to make sure that they have an appropriate communication modality to be able to express those wants and needs. Families find smoother routines, taking baths, eating dinner as a family, getting ready for school. I think of a couple weeks ago, I had a mother call me like in tears, and she was like, we just sat down as a family and had dinner together for the first time like in our life. And so those just like really, really small things that kind of, like I said, some people might take for granted that are really important to y'all's families is so important to us as well. And so these kind of like success stories and smoother routines are really beneficial. And then of course, y'all feeling more empowered to handle challenging behaviors in different settings as needed. I know I mentioned kind of like the grocery store earlier, or just different settings. I have heard so many families that are just understandably like fearful to be able to go into the different community settings because of not knowing, is this loud noise gonna bother us, or is this child screaming gonna upset him? And then we start, engaging in screaming. And so there's so many barriers. But there are so many times that, like I said, we within therapy are working on those skills right there with you together, that it does lead to, like I said, that more empowerment and to being able to take your child on those things that you would like to do. I wanted to kind of, like I said, put on here some different resources and support. Katie Beckett waiver program is a big one for a Medicaid waiver. So if you've applied for Medicaid services and have been denied due to income, Katie Beckett is a waiver program that does provide assistance to kind of pay for different therapies as ABA therapy as well. And they also offer assistance for a lot of other as well. Jennifer will be able to really help y'all with that. She is a guru for those. Parent to Parent of Georgia as well is another fantastic resource. They're a website that you can look at, and I know Jennifer shares a lot of their information a lot of times too. They have so many great resources and can do a lot of things that Jennifer and I might not have within our scope as well too. Babies Can't Wait is an early intervention program. They're really good about kind of, like I said, that early intervention, getting things started. Georgia Autism Initiative, local Facebook groups, which seems kind of silly, but this is one of the, I would say, probably most important one, just because support in a community is like so imperative and something that is you're going to need throughout your entire journey of just kind of, like I said, really needing that support group and that support system. Autism Access and Innovation is another great one. AsYouAre.com is kind of the one I was mentioning earlier, as a virtual and quick turnaround time for diagnostic screening. So if your child or family member or someone you know does not have that diagnostic, that diagnosis of autism, but you're on a wait list for a year or 2 years, this is a great one. Like I was mentioning, the 5-year thing insurance has started doing now as well too. So if you need to get re-evaluated for autism, this is another great one to kind of get that re-eval quickly done as well. Sensory-friendly events within the community, as well as just funding guided, or a funding guide provided by TBS. So I have in my bag that I'll pass around here in a minute. We just have a resource page of just funding and just different grants that are available to families as well for Georgia as well as nationwide. So I kind of wanted to get those out. That is really all I have. I didn't add a slide for like questions or anything like that, but